Hi, this is Cheryl with Peace and Power Movement. Just covering a movement exploration that's related to, the situation where maybe waiting for hip replacement surgery and finding just the pain and the sort of lack of stamina in walking is leading you to rely more on a cane or maybe walking sticks. And so I just want to cover a way to approach that movement so that you're really supporting keeping your pelvis level as you walk, because often as that joint degrades, there's kind of a tendency to sort of, every time you're stepping with the leg that's not supporting you quite as well, there's a bit of a lurch to the side. And it's sort of, taking a movement habit in an area where there is a concern and making it worse through each step. And so I want to sort of demonstrate a kind of approach to really attending to the base of support you have step by step so that you can keep your pelvis more level and avoid sort of really impacting into that hip joint in the same way. And so I call it either the 3 point or the 4 point system. And so, I don't have a cane in my possession, but I'm going to use a walking stick as if it's a cane. And so the core idea is that with every step, if you're working with a cane, you've got 3 points of support so that each time you step, your cane and one foot is on the ground. And so it's a really simple way to sort of give you just a touch extra support so you don't need to lean so hard on the leg that has the issue, and you can support yourself. When you have two walking sticks, it's a 4 point system, right? Because you've got both sticks and both feet. And so again, having both planted so that when you're bringing your leg forward, you have just that little bit of extra support that helps you avoid that kind of lurching sensation. So I'm just going to line up here to demonstrate those movements. So if we're working with a cane, let's say the left leg is the one that's compromised, is this idea that before you lift your foot, you have your cane planted so that as you arrive on the foot that or the leg that's compromised, you have these supports so that this process to bring your leg forward, you can keep your pelvis straight. And then as you reestablish it, again, you're not like leading into, often there's this place of lurch here. This support lets you keep that upright position as you go. So that is a little bit faster. When we come into two sticks, and for an outside context, I really like walking sticks. They help you stay more upright. And that, gives you a more balanced kind of load of your body weight to be held up by your legs and your pelvis. And so the same sort of method, you've got two going. So having 3 points before you step, then you can shift so that again, it allows you just with a little bit of upright support to be able to keep that level pelvis. And again, with practice, a little bit of intentional practice, you're able to then increase your speed a bit. And part of, this is to improve that efficiency so the strain, the pain doesn't sap your stamina. The other thing I just want to talk about, so let's work with the idea that it's my left hip that is, waiting for surgery. How do we turn around? And so, really helpful if we go back to a sort of cane system is to use the leg that's in better shape as your turn radius. So again, you're using this 2-point system to, or 3-point system to support the movement around yourself rather than relying on the compromised leg and sort of, you know, making your way around. This lets you preserve a bit of the integrity of your movement so that you can move without any real sense of, precariousness or loss of balance. So hopefully this is helpful. Take good care and have a great movement day.